Hi everyone, we are live in the Facebook group and I know loads of you have got masses of questions. I've had loads of questions through already, but it seems to be a recurring thing in the group, which is totally understandable. So I want to give you all an opportunity to ask your question. Look, HRT is a hot topic, and you may or may not know this, that we have a private membership called the Latte Lounge membership, and I run a lot of these monthly masterclasses with menopause specialists. So if you want to know more about that, you can email me afterwards, katie@lattelounge.co.uk, and I can fill you in. But today I wanted to invite Dr. Rachel Hines, who is a menopause specialist, and she's also the Clinical Director of Menopause Services at Stella. Now, Stella is the online menopause clinic which powers our new online clinic, which is the Latte Lounge Plus. And Rachel's going to be here today to answer your questions. So, Rachel, thank you for joining me today.
Thank you for inviting me.
Now, listen, before we talk, I'm going to just quickly tell everyone a little bit about the clinic and a background to you. So look, I'm really pleased that we're working with you guys at Stella to create the Latte Lounge Plus, which is, as I said, our online clinic, really because it's a much more affordable option for women to get the support and treatment options they need than perhaps a traditional sort of private specialist, which absolutely has its place, and so does our wonderful NHS GPs. But sadly, Rachel, like my own experience, we're still hearing, the long waiting lists or misdiagnosis. So this is I am happy because this is a really good middle ground. And also, you've got the app as well, the Stella app, which can provide all those sort of extra lifestyle support. And we've had loads of emails actually from some really happy women who've completed. There's a free assessment, isn't there? Yeah. And they've been seen literally the next day. So, I'm really pleased things are going well there.
Yeah, it's fantastic to hear. I'm glad.
Yeah.
Really glad to hear.
So we'll talk a little bit more about that in a minute, but let me just give everyone a bit of background about you. Rachel is an expert in the field of menopause. She's completed the advanced menopause training with the Faculty of Sexual and Reproductive Healthcare, and she's on the British Menopause Society Specialist Register. Rachel's an experienced GP, worked for the NHS for 17 years and specialised in women's health. She also has diplomas in sexual and reproductive healthcare, gynecology and child health, and alongside her role at Stella, she also works at the lovely Claire Mellon and Associates, which is at the Portland Hospital in London. So Rachel, before I get to the questions, do you want to just give us a little summary of how the Latte Lounge Plus works, this online clinic, so that our members understand exactly what they can expect?
Absolutely, yes. You can access, so if you go through the Latte Lounge, you can access directly through to the Latte Lounge Plus clinic. And so you do a really sort of comprehensive online assessment. There's between about 60 and 90 questions, depending on you and the answers to the questions. And it will go through your symptoms, your history, your family history, different risks in terms of what would be most suitable for HRT. And then from there, you can then be offered an appointment with one of our doctors. And also, if it's suitable, you can also be prescribed HRT directly from the assessment. So we use both systemic, so like through the skin or as a tablet, and also vaginal HRT from there. And you've got access to the app, which, as you said, has got just so much support in sort of with lots of different areas like pelvic floor, mood, libido, cognition. There's all these different ways that we can help support the different symptoms that you're having.
Yeah, and the initial assessment's free. One of our members has said she's done the questionnaire. She still has a few questions on whether to proceed. She's had consultations recently with a menopause specialist, but they were unable to provide prescriptions or blood tests. And as you can imagine, she's struggling to get anywhere, sadly, with her GP.
Yeah.
So in that instance, what would be sort of the most sensible next step?
So if she's got questions about us, she can email just hello@onstella.com. It will come through to our team, and we can hopefully sort of help or direct in terms of that.
Perfect. That's perfect.
Yeah.
Her GP won't give her blood tests, and of course now she can't get progesterone like so many others. So with Stella, can I get blood tests done and prescriptions? And what will I be liable to pay for? Thank you.
So in terms of flipping around, in terms of cost, it's £45 a month, and that includes your consultations and the HRT, which we deliver to you at home. We have got a brilliant formulary, which is really well stocked, and we have Utrogestan, which is really positive at the moment, particularly. But so it means that when you have your consultation, you know, the doctors know what we've got available. So we're not going to say, sorry, have some Utrogestan and then you can't get hold of it. So we will only prescribe what we have, and then it's delivered to you through the post. So we know what we're able to give. In terms of bloods, we're not doing bloods at the moment. We will be launching a low libido service, where we can use testosterone, and we will be doing bloods with that, but we're not currently using blood tests.
And also, as per the NICE guidelines, blood
Yes.
tests are not reliable anyway, are they? Because
Exactly. You need them, you need them in some cases, and particularly when women are young. So definitely under 40, and it's recommended, or you consider it under 45. But otherwise, times in which you would consider bloods, that is not very often. So it may be something that your GP could help with if possible, but we don't need to do bloods that often really anyway.
Yeah. All right. Well, Mandy, I hope that was helpful to you. Nuri says, I've been on HRT for many years, but several patches for only a few months. Since January, her breasts are painfully tender since taking Evorel. Is there anything she can do? She also takes Utrogestan 100 every night.
So if you've switched from one patch to another because of availability, it can take some time to change. It should be the same dose. They are the same dose, but it can be that you can absorb differently from one patch to another. So it may well be that you're experiencing the symptoms because you're getting more estrogen from the patch that you're on at the moment. So generally the breast tenderness should settle within a few weeks really of a dose change or a change of patch or whatever you're using. But if it's not settling, then I would suggest seeing your doctor so they can examine you to check and see.
Yeah, and I meant to mention at the beginning that obviously Dr. Hines can't give very personalised responses. That's why it's better to come straight through to our online clinic, because obviously we don't know your medical history, and we need to be a bit careful because obviously you're under your own doctor. Before I get on to the other questions that were sent in advance, Terry is saying that she thinks that all she needs is testosterone. Is this something that the Latte Lounge Plus clinic would prescribe? It's not at the moment, is it? But it's coming soon.
No, so we will be launching a low libido service. Usually for testosterone, you need to be using HRT. So even if the symptoms you're having a low libido, if you give testosterone by itself, it could potentially cause thickening of the lining of the uterus. So, and also often giving back estrogen can treat libido, and you may not need testosterone, but if you were on using estrogen and progesterone, HRT, and the libido still didn't improve, then you would look at adding in testosterone as well. But it's very rare that testosterone is used by itself, and we'll be wanting women to be on HRT already before starting using testosterone.
Sure. Terry's saying she's using patches, but it's made no difference.
Yeah, so in which case, if all your other symptoms have settled, then absolutely it would be appropriate to add in testosterone as well. Obviously, depending on your own personal circumstances.
Yeah,
but
absolutely.
if it was safe to, then yes, it would be fine to start.
Yeah, so as we said, either have this conversation with your own doctors or feel free to come through to our online clinic. Now, we've had loads of questions in advance, so I'm going to kick off with those. So one of our members has said, this is regarding Utrogestan. Yeah. She feels it's making her very fatigued and causing a low mood. She's taking it vaginally and she's thinking of having the Mirena coil fitted. Yeah. Would this help or would it be the same?
So with the Mirena is an intrauterine device. It's a low release of progesterone and it lasts for 5 years. It helps keep the lining of the uterus thin. You're not meant to get side effects from it because it's inside the uterus, but some women can be very sensitive to progesterone. Ideally, you shouldn't get the same symptoms that you're having from the Utrogestan. And I think if you've already switched to using Utrogestan vaginally and you're still having those symptoms, it's definitely worth trying the Mirena to see how you get on with it. It's a different type of progesterone, so it might be tolerated much better.
Yeah. All right. Well, that's helpful. So see how you go. And obviously, again, we're here if you need any extra advice. This next one, can Ovestin vaginal cream be used safely alongside estrogen topical gel?
Yes, absolutely. And often we start them both at the same time. So you might start HRT, but if you're having significant vaginal dryness, you would start both together. And yes, it can safely be used alongside for as long as you need.
Yeah, because I mean, correct me if I'm wrong, because I'm obviously not a doctor, but my understanding is that a day's use of Ovestin is like a year's equivalent, or the other way around,
Um,
of HRT. Yeah.
so that's with Vagifem, so with the
Oh,
tablet. But it's thought if you use one of those every day, it's the same as one oral tablet. So we're using its low doses.
dose,
So it doesn't increase risk from using that as well as the estrogen gel.
yeah. Okay. I get asked this a lot. Does high or low estrogen make you gain weight?
So it's the sort of fluctuating hormone levels that can affect your weight. And it's thought in menopause, you gain 0.5 kilo a year, which isn't very much. Obviously, over a period of time, it adds up, but you get a redistribution of body fat. So fat that, as in, so it moves from kind of your bottom and thigh onto your abdomen, like across the middle. And therefore, women are far more aware of it, and it can make you feel, like you've gained more weight than you may have done so necessarily. But certainly the fluctuation in hormones can affect weight, and many women find they gain more than that.
Yeah. And I mean, look, that this is such a common question, and I think that there's through the Stella app and through obviously the Latte Lounge membership, and on both our websites there is loads of information about how to, whether it's through fitness or nutrition, just trying to help sort of maintain a healthy weight, because I know it's a huge concern. Happened to me, and it's always a bit of a struggle. So thank you for that. Right, the next question. I'm 46 and have been going through perimenopause for a few years. I thought after 11 months of not having a period, I was pretty much done and was going into menopause. Then I got a period. I was starting to feel okay about the change, but since having a period, I feel a bit rubbish and I'm unsure what to do. Will this keep happening?
So menopause, like the definition of menopause, is 1 year after your last period. And unfortunately, some women will, your cycle will just suddenly stop. Sometimes it will become irregular, and then it can become very infrequent, but it can keep happening. If it's been 11 months, it may well be that this is your last period and that there wouldn't be any more after that. But it's because of the fluctuation in hormone levels. And if you've had a period now, that would explain why you may be feeling more symptoms than you have been, because the levels are changing. So unfortunately, it would be another year from now, or whichever way, fortunately, whichever way you look at it, but it takes a whole year to have no periods to say that you actually have had your menopause.
And when would we worry in terms of sort of postmenopausal bleeding? Like, could it be that she actually had come into menopause and this was perhaps something worth investigating further? Like, how do you...
It's over 12 months. So we have a cutoff of 12 months. So if you've not had a period for a year and then you were to have bleeding, genuinely, you would usually consider it to be postmenopausal bleeding. If it was that close to 12 months, it could well be that it is a period. But when it's over 12 months is when you need to sort of make sure you see your doctor to get it checked.
Yeah. So it's probably a last hurrah.
It could well be. Yeah. If it's been 11 months and it's been 11 months, it could well be this is the last one.
Yeah. Okay. Hopefully. Right. Is HRT not recommended for anyone with an atypical grade 2 brain tumor due to the tumor being hormone fed?
So that would need to be discussed with the neurologist, an oncologist looking after, because brain tumors can have hormone receptors, both estrogen and progesterone, and it would be done on a sort of case by case in terms as to whether their doctors were happy to have it. So there's
that's a bit more complicated.
Yeah.
I've got another one a bit like that. Michelle says her skin reacts to the patches, but she's bearing with it as she didn't like the estrogel.
Yeah.
I mean, if a lot of women say they're allergic to the patches, is there anything that she can do?
So there are different, making sure that you rotate the area so you don't always put it on the same place. And it might be finding a different, so usually we say put it on like your lower tummy, like below your belly button, bottom or thigh. And it can be, if you stick it in one area, actually it might be much less sensitive. So I would certainly try applying it to different areas. I was going to say try a different brand, which is a bit of a challenge at the moment due to shortages, which I'm sure we'll touch on. But it's always worth trying. So it can be prescribed what we call generically. So you can say estradiol, and then they can give you what's available. So you can try a different brand, and that's often a really good way of changing it. Using a bit of steroid cream can be helpful, or using inhaler sprays. Sometimes doctors will prescribe to help reduce the sort of irritation from it. But yeah, easy things are changing where you're putting it on and seeing if you can change brand if possible. There are quite a few brands, it's just what you're able to get.
Yeah, absolutely. Okay, another one. Michelle said a different brand didn't stick, so and she does rotate. Well, well, good luck, and keep trying. Obviously, if it doesn't help, then feel free to come to the clinic, online clinic, and ask for some support there. Okay, I have another email. I'm 47 and have symptoms of very low mood, anxiety, struggling to stay motivated at work, mood swings, brain fog. Sounds like everything that I went through. Have been on Evorel Sequi patches for almost 4 months, but still not feeling any change. Is this worth investigating further with a GP, or should I try alternative supplements?
So it may well be that you're needing more estrogen. And Evorel Sequi comes as a fixed dose. So that's a kind of mid-range dose of estrogen. So it may well be that you'd need to split it into having a higher dose patch and then a different type of progesterone to go with it. If there's been no improvement at all, another thing you would want to consider would be checking your thyroid, because that can contribute to all those symptoms as well. And sometimes, if most symptoms resolve but not all, if particularly if low mood or anxiety was continuing even when you're on a good dose of HRT, we'd be considering other options like counselling or antidepressants alongside it, because not everything is caused, by being perimenopausal. But it sounds probably like you would want to consider increasing the dose possibly to see if it would help.
So possibly go back to the doctor to have that discussion.
Yeah.
Karen's put, I moved where I put my patches. It helped with irritation. There is one place on her right abdomen that irritates, but the abdomen on the other side is fine. That's interesting. And my hip on the right is also fine. Very odd, but as long as I avoid that place, it's fine.
It's fine.
Very odd, but yeah, absolutely fine. All right, so my next one is it advisable to start taking HRT quite early, i.e. as soon as one gets some consistent cluster of perimenopausal symptoms while still having more or less regular periods? In her case, she's about to turn 47, or is it better to wait longer, i.e. when symptoms are pretty intense and periods become more erratic?
I think it depends on how much your symptoms are bothering you, because if you've got a few symptoms that you're aware of, but they're not impacting particularly, or they're not affecting your quality of life, you don't need to start. But if you're going, actually, I've got a few symptoms and they're having an effect, you can start HRT even if your periods are every 28 days. You don't need to wait for your cycle to change to be able to start taking HRT. We use a type that's called sequential or cyclical. So you'd have progesterone for half the month and it works with your cycle. So certainly if you're having symptoms and they're impacting, you can definitely consider starting HRT.
Yeah. And I guess there are lots of long-term benefits of starting it early as well. I mean, obviously, you wouldn't just give them to someone that's absolutely fine and not symptomatic. But I know for me, after struggling for 4 years, giving up my job and literally not being able to survive on an hour's sleep a night and just not coping, it was a no-brainer and it was completely life-changing. I think it's a shame that it has to get to that stage. So I think having these conversations earlier, perhaps when you're just starting to possibly get symptoms, is probably not a bad thing.
I think it's so helpful, because then you know what options are available. Lifestyle is hugely important, and seeing if there are changes you can make rather than needing to take HRT. You may not need it at that stage, but like you said, the benefits from taking it, there are really significant benefits. So including sort of helping keep the strength of your bones, maintaining your bone density, reducing the risk of heart disease and diabetes and bowel cancer. And if you start in the perimenopause, it's likely to reduce the risk of dementia. So there are lots of benefits from taking it. And so if you feel that the symptoms are impacting you enough and you've made lifestyle changes, then it's very reasonable to start.
Yeah. And obviously, I'm always so aware of women who can't go on HRT, or don't want to, but especially those who are or feel they're in that high risk group.
Yes.
I mean, I've actually got a question from one lady who was scared of potential cancer. She is in a high risk group. She had an estrogen type pre-cancer, so she didn't want systemic estrogen, but her symptoms were so bad that she did go on HRT for, I mean, it was mainly, she's saying, for insomnia, and she kept getting recurrent UTIs.
Yeah.
Now, if it's not helping, what would you suggest? That she sort of goes higher or goes back to her oncologist?
So it's in that case, it's a really careful balance of how high you go with the estrogen and managing, and it would be a discussion with the oncologist. Vaginal estrogen is really, really helpful. And it may be that if she's already using it, you could increase the frequency or change to an estring or something that gives a more consistent dose approach to, with recurrent urine infections. And with insomnia, it may well be needing other techniques to help as well. So it depends on what HRT you're using. Utrogestan can be really helpful with sleep, so the progesterone at nighttime, but other techniques, so CBT, mindfulness, and looking at that can be really helpful as well. And it's sort of putting it all together, really.
Yeah. And for anyone watching, if you don't know, we have our podcast, Midlife and Menopause Uncovered, and I've done some amazing interviews there with sleep experts. Our next series, we've actually doing one on osteoporosis, bone health, and on hypnotherapy. I learned a lot. I recorded it today, and there's lots of evidence now about things like mindfulness and meditation, and of course, exercise and nutrition. So, through our online clinic and through the Stella app, there's loads of really helpful information.
But just actually on the app, but there is a really useful section on it called SOS, and it's got a really good set, like lots of different, there's sort of meditations and music and lots of different sections. So when you're just feeling that, it's really very useful. But there's lots of useful advice about sleep. There's a sleep program on the app as well, so talking about the different plans that can help, but there's one specifically to help with sleep, which would be tailored to you. So it's really helpful.
Yeah, and I think recurrent UTIs is a huge thing that comes up again and again and again. And I think vaginal estrogen, it can't be sort of overestimated how helpful it can be, and it's really pretty safe, isn't it? So I think people should be speaking to their, well, a lot, you can get it over the counter now. So
Gina.
So yeah. Yeah. Okay. Karen in the group says, could I please ask you about HRT and endometriosis, and whether most women do well with HRT or whether problems do occur over time?
So when you have endometriosis, the progesterone is really important to make sure, because when you start HRT, it can increase endometriosis. So in women that have had a hysterectomy for endometriosis, we would still offer the progesterone. We would often offer progesterone as well to try and prevent recurrence. So it depends. Usually women get on with it really well, but sometimes it may be you would be needing to increase the progesterone, to get the dose right. But yeah, it certainly doesn't mean you can't take it.
Yeah. Okay, let me just read the group. Uma has said, I'm still on a normal period and on HRT, but have had 2 periods per month for the last couple of months. Is this okay/normal?
So it depends on when you start HRT, and within the first 4 to 6 months, it's quite common to get some irregular bleeding. If it's beyond 6 months, then you'd be wanting to speak to your doctor about it. So you can obviously get a change in cycle, and sometimes it may be you're having a withdrawal bleed from your HRT rather than it actually being your period. But if it's after you've been on it for more than 6 months, you want to get it checked, you need to send for review.
Yeah. Rachel, if anyone wants to know obviously more about the Latte Lounge Plus and take the free assessment and find out sort of what treatment options could be suitable for them, where do they go? It's on Stella.com.
Yeah, it's on Stella.com. Yeah, so they can access through you, can't they? And also it's on Stella.com, and it talks you through. So it's really clear. There's loads of information with it.
So it's on Stella.com/the Latte Lounge to go through the Latte Lounge clinic, and you can find more from Rachel. It's Dr Rachel Hines on Instagram and Stella.menopause on Instagram. But as I said, do this free assessment because it's really, really helpful. And I think you'll get a lot out of just doing that, because then you can kind of see where you are.
With the assessment, it tells you where you are, like what your stage of menopause is. When you get to the end, it will give suggestions, but it will say, you know, your perimenopausal, your postmenopausal. It's helpful.
Yeah. So one more's just come in. I'm not sure what this BV is, but yeah, you obviously do. I suffer regular bouts of BV. What's that?
Bacterial vaginosis.
Oh,
So
fine. Okay. Would it's again, so it's would vaginal estrogen help with this? She did read that to get this, she would have to be postmenopausal and over 50.
Okay, so you don't need to be postmenopausal and you don't need to be over 50. You can have it at any stage. But with bacterial vaginosis, you get a kind of smelly discharge, and it becomes more common in sort of perimenopause and postmenopause, because essentially we have good bacteria in the vagina, and if it's drier, then they're not as effective in keeping away infections like bacterial vaginosis. So if you're having vaginal dryness, vaginal estrogen can be really helpful in preventing you getting BV. And yet it can be started in perimenopause. You absolutely don't need to wait until your periods have stopped or you're over 50.
Yeah, it's so frustrating, isn't it? Because some of the leaflets are slightly out of date, and they talk about being over 50. And I think that, you know, you need to sort of look a bit deeper. And I think the whole point of everything I do, and obviously that you do, is that the more information that we give out to women about what's actually the reality, the more empowered you can be to actually say, well, hang on a minute, that's not what I understood. Can we have a chat about this?
Yeah, absolutely.
Yeah. So look, Rachel, thank you so much. Let me just do one more because we have one more minute and I want to ask them all. Okay. Lorraine started HRT on Evorel 50 and estrogen each night, 1 times Utrogestan, sorry, I should say, each night. Last year, at her 3-month review, was asked if she was feeling any improvements in symptoms, which she was, but she didn't feel quite 100% in her mood and motivation. So patches were increased to Evorel 75, but she started bleeding. Utrogestan still 1 every night and 2 every other night, but it made no difference with the bleeding, which is sometimes heavy. All checked with endoscopy and everything was okay. Sorry, this is quite long. Changed to gel in February, and GP recommendation was 3 pumps, as she may absorb it differently, but still can't take any more than 2 pumps without bleeding. How can she take more than 2 pumps, which she feels she needs, without starting to bleed? I mean, obviously that's a very personal case.
But I can expand. But essentially, if you're having, it sounds like you need more progesterone. So you can take 200 milligrams to 2 Utrogestan every night. So if women are having breakthrough bleeding and it's investigated and everything is normal, but you're still getting some bleeding, Utrogestan is brilliant because it's body identical, the same structure as your natural hormones, but it doesn't always give the best bleeding pattern. So options, if you're having bleeding with Utrogestan, is taking 2 Utrogestan every day. Switching to a different type of progesterone is definitely an option, or having a Mirena fitted. So they're having the hormone coil, because that keeps the lining of the uterus thin. And then, you know, if you were to get any spotting, usually it's from while it's settling down, and then you shouldn't have the bleeding, and you know that it's keeping it safe, everything's safe.
I hope that was helpful, Lorraine. And this is a perfect example of why our online clinic at the Latte Lounge Plus is so helpful, because I think what happens, and I've been there myself, is that you go back and forward to your GP and, you know, they're so under so much pressure and you only get 10 minutes, and then you sort of almost have to sort of wait until the next time and then the next time. And I think being able to sort of fill out this assessment with everything and have this sort of 20-minute, you know, online conversation like you and I, which is very personal to you, is very, very reassuring. And I hope people will try it out. The good thing about the Latte Lounge Plus is that you're not tied in. It's not like you have to stay, you know, for a year. You know, you try for the first 3 months and have your follow-up, and if everything's great, then fabulous. But you can carry on, and also the app is just so supportive. And actually, Emma's obviously mentioned about healthy lifestyle. So, but Emma's just said, will bloating subside? She's 6 weeks into HRT, 2 pumps of gel and Utrogestan. Is it the progesterone causing it? She can't get her genes on comfortably. She's 40, early peri, history of endo, and she does have a healthy lifestyle.
So, I mean, you can get bloating when you start. It's more commonly from the progesterone rather than the estrogen, but certainly you can get it from both. So one option can be using the progesterone vaginally and see if that settles, because it's quite an easy way to be able to determine which one's causing it. And if it's still not settling after making that changes, then you need to discuss what would be the best way moving forward. But it's just giving it some time when it starts to let everything just kind of bed in, which is why normally we review it 3 months, because then you can see how you're getting on with it. But you can, so it's an off-license use if you use Utrogestan vaginally. It's not licensed, but it's safe to use.
Before I let you go, because I am going to let you go, we're all aware of shortages at the moment, and it's really hard and frustrating when you've just got used to what you're on, and then you can't get what you're used to, and that causes so much anxiety for women. Women are driving to lots of different pharmacies. They're getting very stressed, they're perhaps swapping, sharing, which is not safe. What is your advice, and do you know what the situation is on the ground? I did ask Maria Caulfield, by the way, and we're supposed to have an update this week. But what can they do?
So essentially, the reason that is given is that there's been an extraordinary increase of number of women using HRT. And so many more women are using it now than before. It's still not actually such high numbers, but there's been such a big increase in a short amount of time. The biggest problem at the moment I'm experiencing is Utrogestan. That was meant to be a short stop in January, and it was meant to be better, but it's not. I think it depends on where you are, and it certainly seems to circulate, because I know where I work, we've had times where we've had no problems and women are coming in going, I can't get it anywhere. We don't have it at the moment. So it seems to really fluctuate. Apparently Utrogestan is coming in and some has arrived, but it takes time to filter through. If you really can't get the Utrogestan, if you're using it vaginally, there are different types of pessaries that we use. They're not Utrogestan, but they're also a similar hormone. Or you can switch to an alternative progesterone as a short-term option, or have a Mirena fitted if you're able to do so. Obviously, you can't just walk in, but that's a really good option, because then you've got long-term progesterone. And in terms of the estrogen, again, that's really tricky. So the biggest shortage at the moment is estradiol. And some strengths are available, but not all. But when the 50s and 75s are coming back, I don't know. It's what most people use. But so again, it's using a different brand of patch, or possibly switching to the gel or the spray if you've not used it before. It is frustrating. So it's making sure you ask for your prescriptions early. Not too early, but give it, 2-3 weeks rather than waiting for it to run out.
And does the Latte Lounge Plus clinic have good stocks at the moment?
Yeah, we really do. We haven't got 50 estradiol, I don't think. And we've got Utrogestan, and we've got a few different brands. So we have got a really good supply, and it varies and it's updated, but it should very much be the case that if you have a consultation, that is what gets delivered. You shouldn't get an alternative when it arrives. So we're doing live prescribing, because you can stock check, which is really helpful.
Absolutely. And if HRT is right for you and you're prescribed, the beauty of our online clinic is that it gets sent directly to your house, so you don't have to certainly drive around trying to find it. Rachel, thank you so much. I hope everyone who was watching this found this helpful. But as we said, if you have any questions at all, you can find it. It's on stella.com/the Latte Lounge. So thank you. I hope everyone found that helpful. Have a good lunch. Thanks again, Rachel.
Thank you very much, Katie. Lovely to see you.